For millions of people, it's not if, but when your ears won't hear the way they used to. What used to sound like this, muffled or not loud enough, right? Not all hearing aids are the same, so it's not also just about amplification. Joining us with the latest technology and quality to improve hearing is Dr. Mark Nichols with Houston ENT and Allergy, and their patient, Mike Griffin, who is AKA a silver fox. Oh, see, you heard me say that. See, now, just a little while ago, if I had said you're a silver fox, you may not have heard that, right?
No.
Yeah. All right, so just checking. All right. When it comes to hearing loss, it's like one of those things you don't know what you're missing until it's gone, right? And it's such a basic part of life. You were moved by, and I can understand this feeling because when the cochlear implant came out, right. I remember hearing a child who heard her parents' voice for the first time. That was a life-changing moment for you as well.
Absolutely. When I was a resident in training from the University of Texas Medical Branch in Galveston, we spent time up in Houston with ear surgeon Dr. Ed Maddox, and he implanted a little 2-year-old girl, Noelle. She's from the Rio Grande Valley, and he goes, I want you to go listen to get her device hooked up. I want you to go listen to the process, see what they do. And when they turned the implant on and she heard her mother's voice for the first time and cried, that was life-changing.
Yeah. So most people don't have to go that far with the cochlear implant, but having a hearing aid, hearing loss oftentimes happens gradually. And so for you, Mike, when it was starting to happen, when did you realize it was really more of a problem?
Well, the biggest issue is that you'll be in a family setting and they'll be talking, you say, I'm sorry, can you say that again? You know, and it's annoying and sort of have people reset. Or in this case, I own an investment firm called Silver Oak Financial Group. And I remember I was doing an interview with somebody and I kept interrupting him saying, say again, say again. Needless to say, I didn't get the case. So,
But that's hard. I know for my mom, she kept saying we were the problems because why is everyone talking lower and muffled now? It's like, well, Mom, it's not us. So it takes a minute sometimes for people to admit or understand that there is a problem with hearing loss. And there's a difference there's different types of hearing loss. Conductive hearing loss is one, and then sensory neural hearing loss.
Yes, conductive loss is anything that interferes with the conduction of sound through your ear canal, through your eardrum, through the delicate hearing bones to the inner ear is a conductive loss. It could be something as simple as wax plugging your ear canal. You might have a hole in the eardrum. You could potentially have fluid in the middle ear, like we see frequently in children.
When they have an ear infection or something.
Right, exactly. And then sensorineural deafness is the other type of hearing loss that accounts for most of the hearing loss that we see. And that's caused by any kind of effects on the electrical system of the inner ear, from the inner ear, the cochlea, the auditory nerve, all the way to the brain. So it could be something as simple as noise, damage to the ears, the aging process. It could be heredity. There are certain drugs that are ototoxic that can damage the inner ear and cause a nerve deafness.
Yeah, and that's why I said it's not if, but when for a lot of us. We're kind of, there's certain body parts that we kind of outgrow, right? Teeth can be one of them, our eyes start to go south, but the ears as well. Did you listen to a lot of rock music, Mike, growing up? Yeah, but that's not the only reason, as you mentioned. Okay, so a lot of folks, again, think that it's just a matter of amplification. And I know going through this process with my mother, I realized there is so much more to this. So when people are thinking, I'll just buy an over-the-counter device, there's a whole lot more to that than just that.
Right. I mean, the big part is assessing the patient, find out their listening situations, find out what they're having trouble with. And then obviously we're going to test them. We're going to see what their speech discrimination is, what their level of hearing loss is. And then from there we can come up with probably the best type of hearing device that'll help them. Some people that we see initially, unfortunately, they come in when it's too late for a hearing aid, and those people we are able to fortunately help them by doing a cochlear implant. But there's so many others out there, there's so many patients out there that need to be helped that are not coming in and taking advantage of this.
Like so many things, when you put it off, it just gets worse. So Mike, you realized that you had a problem hearing. Did you go in right away to get it assessed?
Not really. It took me a while, but the thing I wanted about Dr. Nichols' office, the first place I went, every time I went there was a different story. And someone recommended Dr. Nichols, and I went, and they're the most straight. He shoots straight at you. You ask a question, you get the straight answer, and they've helped me so much over my first experience with hearing doctor.
Yeah, which goes to show not every doctor's the same, right?
Oh, no.
You all specialize in the highest of technology,
Right.
And also, again, beyond just amplification. I know that for some people, it's like, for example, the frequency. You got to deal with what frequencies can they hear. You go through a whole process for that.
Yes, ma'am. Yes, ma'am. And we have audiologists, doctors of audiologies that are trained to go in and do the testing and program these devices. These devices are very small, digital hearing devices. This is a CIC, an in the canal hearing aid, but it's digital. It's very powerful, and it provides amazing hearing restoration.
Yeah, in fact, well, you say that, but I'm going to take this out of my ear right now. I have what we call an IFB, and so on this right here is how the producer communicates with me, and so so I'm familiar with that. But there are a lot of folks who, out of vanity, would put it off because they didn't want this big hearing aid over their ear. They don't have to have that anymore.
You don't have to have that. You can have this, and you can't see that down in your ear canal.
Yeah, in fact, I was looking for yours. I still can't see them, right? And then
this is the behind the ear. That's what he's wearing.
Okay,
you can't even see that.
I can't even see that. And then the other thing is the dexterity part, right? So sometimes, like changing a battery. I know I have to change the battery in this one, and fingernails get in the way. You have devices where there is no battery. Or not one that you have to change every day.
They're rechargeable.
Yeah.
Yes, ma'am.
Yeah.
So that's a wonderful technology. Everybody used to complain about having to change the batteries frequently, and now you don't have to do that.
Yeah. All right. Someone out there we know is putting it off or not admitting that they have a problem. What do you say to them to get them in to go and get their hearing taken care of and get back in the conversation?
You don't realize what a change it'll make in your life. You can suddenly participate in family discussions without saying "say again," and it makes everybody more relaxed and easy to deal with.
Yeah, and just get it taken care of the right way now, as opposed to messing around and getting something that doesn't work. All right. For more information on Houston ENT or to book an appointment, you can call 281-699-5609. Again, that's 281-699-5609, or visit HoustonENT.com. I'm going to say it one more time, Silver Fox.